Welcome. My name is Christy, and I am here to talk to you about lung health. I have been a respiratory therapist for about 13 years, and I started at the Women's Expo, and I really enjoyed it. It was something that I felt that God had called me to do. We were talking to individuals about using their medications and using CPAPs, because that is something that I work with on a daily basis. I then started working. I was asked to come and talk to the church about working about lung health, and so here we are. When I first started, horses was one of my biggest passions. I loved horses, and when I got started learning about horses, believe it or not, COPD is something that is shared between human. It is not. It is that we share the same acronym. Let me rephrase that. This horse, as you can see, is getting a breathing treatment, and so I'm sorry. I am a licensed and registered respiratory therapist. I have to go to school. It takes about 2 years, 2.5, 3 years or so to get through all of my schooling. I study specifically lungs and the diseases and medications. I learn how to ventilate patients on a ventilator. In order for me to practice in the state of Michigan, I have to take a registry test. And in order to be licensed with the state of Michigan, and then I go on and get an extra test to become registered. I find that the Bible talks a lot about breathing, and the Lord always has such an inspiration. So I wanted to share a couple texts with you that really were kind of interesting to me. One was the Genesis 2:7. Then the Lord formed the man out of the dust from the ground and breathed into his nostrils the breath of life, and the man became a living creature. And 2 Timothy 3:16, all scripture is breathed out by God and profitable for teaching, for reproof, for correction, and for training in righteousness. And of course, Isaiah 42:5, thus says God, the Lord, who created the heavens and stretched them out, who spread out the earth and what becomes of it, who gives breath to the people on it and the spirit to those who walk in it. And it is such a reminder that God has made us, and we are so incredibly and uniquely made. And it's always something to remember. One of the first things we need to start with is always start with the basics. So we're going to start with anatomy and physiology of the lungs. And the anatomy we're going to see here is the trachea coming down, and that is our main air or windpipe. Okay, we have two different, we have a right and the left side. Our right side consists of 3 lobes. Our left consists of 2. And one of the unique things about the left lobe is God actually has a notch in it. And this notch actually is, it cradles the heart, okay? That when you look at this picture, it kind of looks like a little round little place for the heart to go, and that's exactly where, and it just sits right in there. We also have the diaphragm. The diaphragm is a part of the respiratory system. It helps us to expand those lungs and to push all that air out and bring the air in. One of the things that I really enjoy is the springtime. I really enjoy the changing of the seasons and the buds on the trees. And when I teach people about lungs, and about oxygenation and about their body and about the lungs. I always like to refer to nature because sometimes we, learn easier with examples. So in this example I'm showing is with the tree, how a tree looks like our lungs. And it is so true because in the springtime, and especially like right now, the buds on the ends of the trees are coming out, and those are just like our alveoli on the ends of our bronchioles. We have that main trunk coming up, and then some bifurcate. We have those medium to large airways, and then they get out and they get smaller and smaller and smaller. And on the very, very teeny tiny ends is the alveoli. Those are very important. Those are probably one of the biggest importance of our respiratory system, helping us to oxygenate and then taking that air in, and that oxygen goes to all the parts of our body, making us nice and pink. So let's talk about these alveoli. Why are they so special? These alveoli are so numerous. And as you can see in this next slide, I will show you why they're so incredible. We have about 480 million alveoli in a pair of lungs. Okay, so that's in each of our lungs. We have 480 million. That is mind-blowing. Okay, and what their sole purpose is to transport the gases that we breathe in. We're going to take in oxygen into our airways, down into these little alveoli, and these alveoli are going to expand. And then as you can see in the picture, there's this webbing, okay? And those are the veins and the capillaries. The capillaries taking that oxygen back up into the body where it's utilized. And then we have the veins and the venules that actually surround that, which take carbon dioxide from our body that we produce and expel that into the air. Excuse me. So again, the purpose of the lungs is to transport gases in and out of the lungs. Very important. In this video, you're going to see some alveoli. These alveoli, we call this alveolar recruitment, okay, in this video. And you're going to see these little air sacs. Some of them are going to grow, and they're going to grow, and they're going to grow. And it's very interesting. I hope you enjoy it like I do. So as you can see, there's not that many. Here's some alveoli. And as they're expanding and expanding and expanding, that is so neat. Like this picture is showing, we need to recruit these alveoli. In doing so, we're going to be taking good deep breaths in. And I will be talking about that later on in this video. A couple things that I wanted to talk about this video. I know that we don't have a lot of time to spend together, but I wanted to touch on a few things when we are together. So these are the things I want to talk about. I wanted to touch base on asthma. That is really prevalent. I also want to talk about COPD, and I also want to talk about pneumonia. And I am going to slide some information about smoking. These are just a couple really brief, very general topics that I want to talk about that affects all of us. It's important to me, and hopefully it's important to you. Let's talk about asthma. Asthma is an inflammatory response, okay? Meaning that your body is going to swell, or this inflammatory response, it's the body's way of protecting itself from harm or pain, okay? Some of these things that can trigger a person who has asthma is pollen. Right now, I believe the pine tree is pollinating right now. There's about 11 months out of the year that it pollinates. So there's pollination going on about 11 months of the year. There's only like 1 month, and I believe that is February. Cigarette smoke is one. Being by the secondhand smoke or smoking itself can cause asthma. Pet dander. you know, when I have my dog Poppy, she comes in, sometimes she causes me to cough, sometimes, so I have to take my inhaler. Dust mites is one. It's really important to kind of keep the house swept when you have asthma. That's the best you can. We're all busy. Fumes, perfumes, strong smells. Sometimes you're very sensitive. I'm sensitive to some strong fumes. Just really good things to know. The last two are very important. Stress. Stress is very important to note, okay? We are all very sensitive to stress. We all handle stress in a different way. But it is also good to recognize that if you have asthma and you get stress, it can be a precursor to having an asthma attack, okay? So it's just something to kind of stick in the back of your head. Illness is another one. If you get a cold or if you get an upper respiratory infection, that too also can trigger an asthma attack. Things to think about. So I wanted to kind of point out what happens in an airway. We have three different examples here. This gentleman this airway on the left is nice and normal, okay? It's nice and open, normal airway. You're having no inflammatory response. So right now, Fred is walking down the road and he is having no problems, okay? All of a sudden, Fred's gonna go and walk by, let's say he has, he's allergic to the pollen of a pine tree. That pollen is gonna come in. So when your nose filters that pollen, there will be some that gets down into the lungs, and the body's response will be to go, oh my word, I don't know what this is, let's get this out. And so our bodies will naturally generate mucus, okay? This mucus in turn irritates the airways, so it creates more mucus. So when you are having an asthma attack, you are generally coughing. It is not uncommon that you're wheezing, and it's going to cause the airway to constrict, okay? So it's really important that you have your right medication to help stop that, okay? So you see these three examples of what an asthma attack is doing. What I want to do is, what I wanted to do is look at this little picture right here. This little picture here on the right-hand side, we have a normal airway and the color, normal color and structure of an airway. Normally, when you look at an airway, I have looked at somebody's airway, and they definitely need to look like that, okay? Nice and open. They have that nice little hue of red and pink, nice pink, not the angry pink that we see on the right-hand side. But we want to see that. We want to see that good, nice airway. If you look on here to the left, on the right, the inflamed airway, this one has bronchitis. So you're going to notice how inflamed this airway is, and you're going to see how there's not that really good definition of the airway. That's not a good thing. So I want to talk about some asthma prevention. What can you do? What can I do to help prevent getting asthma or being educated? So one, if diagnosed for asthma, please consult your primary care physician. If you feel like you're having symptoms, a lot of symptoms is a progressive cough. Sometimes it is wheezing. I was diagnosed with asthma about 5 years ago. I had a persistent cough. I thought that I was a pretty well individual, but I just could not get rid of this cough. And so I went to a primary care physician, and they recommended me to an allergist. I did go to an allergist and gave me some medications. Yes, it helped, but just things weren't really working quite well. So I ended up going and seeing a pulmonologist. Now, a pulmonologist is a doctor that is licensed to he studies lungs. His specialty, he went to an extra rotation for in lung management, and I believe that's also an intensivist. So it's important that you find the doctor that fits the needs of what's going on. Okay, do your research. Don't be afraid to ask questions don't be afraid to ask questions that you were prescribed. So if the doctor prescribes you medications, don't be afraid to ask questions. I always like to ask questions, and questions are very important. One, for your knowledge, and two, I think that helps the doctor know that you are on the right page. It gives them a feel and a sense of understanding of where you are. Okay. The third thing is make sure you assess your breathing on these medications. Your doctor will more than likely set you up with what's called a pulmonary function test. And it's important that you find these things out. This pulmonary function test studies the different volumes in your lungs, okay? It measures how obstructive you are or restrictive you are, okay? If you're an asthmatic, you're gonna tend to be more restrictive, as in you're gonna be asthma is a constriction of the airways, okay? As opposed to when we talk about COPD is more obstructive, okay? Because there's gonna be mucus and things of that nature. Anyway, so make sure that you assess your breathing on the medication. So if the doctor prescribes you a medication, do some education. Educate yourself on that medication. Have him educate you on that medication. How does it work? Am I giving the right tools for that? For example, if I'm going to take an inhaler, I want to be able to have a spacer, and a spacer is going to help me get that medication down to where I need it to go. And he's going to instruct me. Make sure you're instructed on how to use that. Another example is you're going to maybe give an aerosol treatment. Why is that? How is that aerosol treatment helping me? Where is that going? Medications are usually based on droplet size in respiratory, because we want the medication to drop out at certain different points, okay? So just questions that you need to be asking yourself and asking your healthcare provider. Very important. So let's talk about COPD, chronic obstructive pulmonary disease. So we know that horses get COPD, but humans, yes, we get that. We get that by smoking, by secondhand smoking. You also have, you can get it by having bronchitis for a longer period of time, or having multiple episodes within a year. That also can be considered as COPD. There are many guidelines, and again, your doctor would need to diagnose that for you. I cannot. Environmental. Be sure to, and environmental would probably be a good one too for asthma, because you're going to be exposed. If you're being exposed to dust or chemicals, make sure that you're wearing a mask. Make sure that where you're working is providing you with a mask. For example, about 10 years ago, when I first started respiratory, I took care of a gentleman, and I think he was probably in his mid-30s. Very young guy, very fit, but the guy had worked in a paint factory, and he was painting cars and did not wear a mask, or wasn't given, I'm not sure of the details on that one, to make so make sure that you get a mask. He did not get that mask, and he unfortunately had gotten COPD at quite a young age. COPD is indiscriminatory. We could also go in and talk about, I'll talk about some other things here later when we talk about smoking. But again, environmental, there are lots of things around. Just make sure you're wearing a mask. And things to think about when you talk to your primary care physician. COPD. So this poor guy, these are just some symptoms of COPD. Easily fatigued. These, a lot of times we call it end stage COPD. These people are going to they're going to be easily fatigued. They're going to be using a lot of their muscles to breathe. We call them accessory muscles. These muscles right up in here and in here. Barrel chested. Barrel chested is just where not able, they're using those muscles to clamp down and to blow out. It'd be similar to if you blew up a balloon multiple times and then by, maybe like the fourth or fifth time, that balloon is just not totally getting the air out. That's exactly what's going on with these COPDers. Again, this process is managed. It is, it's not something that is cured, but it's not, but you can live a good quality life. Again, maybe doing pulmonary rehab, that might be something that you might want to talk to with your doctors. Pulmonary rehab is all about education and all about exercise and teaching people about their disease process and making sure they're giving them the tools to get to have a good quality of life. Oh, I'm sorry, I'm going the wrong way. So let's talk about pneumonia really quick and very briefly. So the leading cause of pneumonia is smoking, okay? And that is just because you're bringing that foreign unfiltered air into your body. It's more prevalent for those who are younger than 1 and older than 65. Those with when I say comorbidities, I am talking, heart disease, and you have multiple, when you're having a hard time breathing, those are probably the kind of the group that is going to have a hard time with this. There are generally 2 types, bacterial and viral. Bacteria is where you're going to be able to treat this pneumonia. Obviously, it's a bacteria, so you're going to be able to have antibiotics. And the viral is more or less something that you're going to have to, it's going to take a process of time in order to heal. I mean, this is not something where you're going to walk out of the hospital and you're going to be well, okay? It's something it's going to take weeks to months to get over. And there is something called walking pneumonia, and that is generally that's actually fairly common too. Let's talk about smoking. I do want to say this. I do not want to come at this and just say you need to quit smoking. I want you to come to that point for yourself. You know what's good for you. I have taught or educated people on not smoking, and one thing that I have found is that, lecturing and saying this is really bad and, you should quit, that's something that you need to make a decision for yourself. And I want you to know that it's not something that I like to push on people. I want people to come to this because they want to make that decision. Quitting smoking is probably up there with quitting heroin. Nicotine, the drug that's in cigarettes, is one of the hardest things to quit. It is actually harder to it's actually equal with heroin. So when I am sitting here and talking about this, I am certainly not trying to push this on you, but I want to let you know that we are praying for you. It is difficult. We all have things in this life that we have to work on, and they are hard, and they are our own trials that we have to work on. And I want to let you know that we are praying for you, that there are people out there that are struggling and we're thinking of you, okay? So some of the risks from smoking, and you can see some here, obviously cancer is one of the risks here, but chronic diseases, we have stroke and gum infection, pneumonia, hardening of the arteries, chronic lung disease and asthma. The list goes on, and you can definitely read some of these here. It's just really important for you to make that decision for yourself, and hopefully your loved ones can make that decision to be healthier. So I wanted to talk really briefly about some of the benefits of quitting smoking. One, it improves circulation right off the bat. It constricts your vessels, and so quitting smoking actually improves your circulation. It improves your lung function. That's 2 weeks to 3 months after you quit. It is remarkable. I have treated many people who have quit smoking, and it is amazing. And you know what you have to do is you have to take one day at a time. If you have to take 1 minute, 1 hour, one day, you know, take it, because it is the best decision that you will ever make in your life. So I want to talk briefly about medications. Now, again, I want to stress, I am not a doctor. I cannot prescribe these medications, nor am I getting paid for these. But I wanted to just show you that these are some of the examples that are the medications out there. You have heard about Ferree, you have heard about albuterol, you have heard about Advair and Symbicort and things like this. These are all these medications that doctors will use for helping you improve breathing. So here's my mucus guy, mucus rules. Oh boy. So let's just talk about a couple examples of the medications that you would use with respiratory. So again, bronchodilators is exactly what it is. It is a bronchodilator. It's going to dilate that smooth muscle, and these are fast acting. These are going to happen like within less than in 2 minutes, maybe, of taking the inhaler. Okay, they come in aerosolized form and in a puffer or an inhaler. Okay, so aerosolized and puffer. So there's about 180 names for albuterol. There's ProAir, Preventol. You know, so I mean, for me to go over all of those, there's so many. Inhaled corticosteroids. Those are Symbicort and Advair. Those are dual acting inhalers. And when I say dual acting, those are, we also call those maintenance. So they're doing two different things. They're doing the bronchodilator, so they're doing the job of what albuterol would do, and then they're doing what would, they have solumedrol or steroid. Now, when I talk about steroids, I'm not talking about like you're on milligrams, okay, like you would get on, that's not what I'm talking about. These are micrograms. These are specifically designed to go and work in the lungs, and that's where they work. They don't work anywhere else. They don't move all over the body, which would be systemically. These do not do that. These are specifically inhaled in through your lungs for them to go down to your lung and work in those airways, those large to medium airways, okay? Mucolytics. That medication would be guaifenesin. Anytime you see guaifenesin, that would be a mucolytic, okay? That's mucus type medication. The kind of the kicker with that medication is that you have to drink water, okay? You need to drink water, and you need to drink, drinking the water keeps you hydrated, okay? And we're going to be talking about that too. Keeping you hydrated, keeping that mucus and that so that you can keep coughing that up. Oops, I went the other way. Inflammation. So I just wanted to touch base a little bit about this. I mean, there's just so much information out there, and we could do a whole nother talk on inflammation alone, because there's just so much to talk about. Our body's healing response to pain is through inflammation, okay? So if you are allergic to food, you know, that type things, it can be represented two different ways. It can be a chronic response, a chronic inflammatory response, or an acute. You know, I could probably get up here and say, don't eat this food, eat this food. The important thing is that you need to find what works for you. You can go out and get testing for this. You can either go through your doctor, or you can, I've seen where you can buy kits to find out what you're allergic, like foods, for example. I believe it like runs $150. I'm not sure. I do have a cousin that did use that, and she said that it worked well for her. And I've also done research where people that it didn't work well for them. So you need to figure out what works for you. because, certain things are could be inflammatory for you and not for me. So, do your research, but most importantly, eat a balanced diet. Eating a balanced diet, eating healthy, definitely going to help your lung and breathing and your overall health a little bit better. So I wanted to talk about, just really briefly, about taking a deep breath in, pursed lip breathing. So pursed lip breathing is important because we want to do a couple things. One, we want to help open up those airways. So there's a big word that they put out. Doctors will say this, and some healthcare providers will say this big long word. It's called atelectasis. Hey, Christy, you've got some atelectasis. Well, I just want to news break here. We all have atelectasis, okay? So we all need to work on taking these good deep breaths. The problem is that as we get older, we tend to not take as much deep breaths. So it is so important that we work at taking these. And you can get those deep breaths done through exercising, through doing some breathing exercises on your own. Any way you can get these done is really good, okay? So maybe we could try some here together. So first, what I'm going to have you do is you're going to take a nice big deep breath in through your nose, nice and slow, and then you're going to feel your lungs expand, and you're going to feel them expand as far as you can get. So just nice, and then you're going to purse your lips together and blow out. So here, I'll show you how it's done, and then you can try it. Okay, ready? Okay. Goodness, I feel relaxed already. So it's going to do two things. One, it can help slow your heart rate down. It can also help with relaxation. And when you're feeling short of breath, it can help with that and help open up those airways and help release the trapped air, okay? Because sometimes we trap air. That's just the way it is. So taking these good deep breaths is so good. And if you're feeling like you're just, sometimes you're just having a crazy day. I think we're all having kind of crazy days being locked in our houses. It is so important for you to find that happy place, go to your room. I think I just need to go right there, and I'm going to take some good deep breaths. And life is good. So lung expansion is good. Oxygenation for the blood is even better, and relaxation to boot. We're going to create this nice, happy environment, taking those good deep breaths and relaxing and oxygenating our blood. Maybe we should take a deep breath in. Okay, so we're going to talk about the elephant in the room here, the coronavirus and COVID-19. I'm not talking doom and gloom. We have enough of that out in this world already. I just want to kind of touch on some key points that I thought were interesting and go from there. Okay, light and easy. So some of the things that they have pointed out is that they have a post-exposure, it's 2 to 14 days. So if you have been out and about, we need to kind of keep this in mind, okay? We need to look for certain symptoms. Fever, are we running a fever? And if we are, probably should document it. Just write it down. Just say, okay, so maybe at 7 o'clock, I kind of felt a little feverish. I'm gonna write that down. Just write it down. Maybe if you got a cold, maybe you got shortness of breath. Maybe you got some persistent pain in your chest. Maybe you've got pressure in your chest. These are all signs and symptoms of maybe having this virus. I am not saying you do. I don't want to have to find out from a doctor saying, well, I listened to this video and they said I have it. I am not diagnosing that you have it. I want to give you the tools and the information to make a decision for yourself, okay? I want you to be able to say, hey, I had a fever, or I had a cough, I have a little bit of chest pain right here. Those are the tools that I need you to know, okay? Educate yourself, making educational decisions and saying, you can do this. This is going to work as it's working similar as a viral pneumonia, okay? This isn't something where they can just give you some antibiotics and away you go. Now, I'm not saying that the medications that the government have found work or don't work. I'm not saying that. I'm just saying that it is going to work like a viral pneumonia, which means it's not just going to go away, okay, right away. Some preventions. Stay hydrated. Remember I talked about this? Drink this. Drink water. Get your system hydrated. One of the things that I have been hearing is that people are becoming dehydrated. And by the time you're dehydrated, I mean, you might as well be drinking this when you can. We're here in our homes. We got plenty of free water. Anyway, so stay hydrated, okay? When you're thirsty, usually that's a sign that you're already dehydrated. So you really need to drink water. And if you feel like you just can't drink water, maybe put some lemon in there. That's really good. Stay rested, okay? Make sure you're getting some good sleep. Keep that body rested. Eat healthy. Eat some balanced meals. I know it's kind of crazy, but I'm going to tell you that there are plenty of fruits and veggies out there just waiting for you to grab, okay? Get plenty of exercise. I know that they're telling you don't go outside. Go outside. It's going to be 60 degrees this weekend. It's going to be great. I'm going to take my dog for a walk. I have been actually enjoying taking my dog for a walk. Spending time with her, I don't know. I have a 45-pound boxer. She's a handful. So get outside and walk around the house. If you can't go for a long walk or walk around the block, just walk around your house. It's spring out there and those plants are coming up. Take a look at those. See what's going on there. Keep a healthy distance. Sometimes it's really good because when people cough and some people don't cover their mouth, that cough can shoot about 20 feet, they say. Okay, so keep a nice healthy distance, and most of all, do good hand washing. Okay, hand sanitizer is good, but hand washing and soap and water is even better. Okay, and then the very end, God is in control. I don't have to worry about anything. He says, I will never leave you nor forsake you. And I'm going to take that to heart because he's never going to leave us nor forsake us. And I'm good with that. I love that. That's my favorite. That was one of the wonderful things I love about the Bible is it tells you he's never going to leave me nor forsake me. So one of the things, we just talked about some of these things here. Exercising, walking and running. If you can run, fine. If you can walk, that's even better. Get out there, take those good deep breaths, move those lungs. Those lungs are so important. We only get one set of them in a lifetime. They're important, they're keepers. Learn how to learn those breathing techniques. So with pursed lip breathing, if you're experiencing that shortness of breath with your asthma or your COPD, use these tools. Use that pursed lip breathing to help slow your heart rate down, slow your shortness of breath. Open up those airways and push out that trapped air. And relax. Use it to relax. This world is stressful. Use these tools. It's nice. Drink lots of water. Keep yourself hydrated. Can't stress that enough. Okay? Keeping yourself hydrated keeps your secretions in your lungs hydrated. Okay? So then you're going to be able to cough those up. You don't want to get dehydrated because the minute you get dehydrated, that mucus is going to become thick. Okay? Just things to think about. And to keep a positive attitude. I know it's hard in this time and we're all kind of feeling stuck. But again, go outside. I've got crocuses coming up and I am enjoying seeing them come up, those bright purples and some yellows. It's really pretty. And those hyacinths that are coming out, get out there and enjoy and look at them because the Lord made this time special for us to go out and see how the renewal of life comes around. It's great. also wanted to mention one more thing. You know, sometimes when we go to hospitals, they give us incentive spirometers. Use those tools. Use those tools. Don't throw them away. One time I went up to Traverse City and I had somebody throw them away. Actually, I found it in a garage sale. Don't do that. What I want you to do is use those tools. That is a good way to help work those lungs, see those volumes, and if you're not getting all the way to the top, work yourself up to that top. They're very useful. Good to keep around. So I want to talk about prevention, and I kind of got this little joke here. I'll just check WebMD for my symptoms, and I'm dying. Well, aren't we all? What I want you to do is try doing health journaling. If there's something that's coming up, these are ways to help prevent things. You go to your doctor, say, hey, so 2 weeks ago, I was experiencing this. Then I experiencing this again 2 days after that. Show them that. That helps you to remember. Write down your symptoms. Write down your feelings at the time. Write down are you experiencing shortness of breath? Did I take my inhaler and it worked? Let them know that. I took my inhaler and it didn't work. They want to know that. Trust me, they want to know if that works, if your medications work or don't work. Ask questions. The most important thing you can do is always ask questions. My motto when I work in the hospital is, the stupid question is a question not asked. I want my patient to ask me questions. I want my patient to, even if it's the most silliest question in the world, I want you to ask me. I want you to let me know that you're thinking about this, that I'm giving you all the information that I can give you. Is there something that I need to give you more? Ask those questions. And if they can't give you to them, I am sure that they're going to find somebody who can. So ask those questions. Don't be embarrassed about that. And seek medical help. If you have questions about your health, don't wait. You're important. You're important to God. You're important to us. And seeking medical help is important, okay? We want to keep you around. I feel like you have some loved ones that want to keep you around also. So I have some websites here for COPD and asthma. These are just a few sites that I go to if I are looking for updated information. As you can see, I have the cdc.gov on here. That's a really good source for the COVID or the COVID-19 or the coronavirus. You know, seek out information. It's good to be informed, okay? Don't be scared, don't be afraid. It's going to be okay. Because remember, God is in control. And I wouldn't be a respiratory therapist if I didn't talk about alternatives for smoking. If you feel that you want to quit smoking, Michigan, I believe, still has a program, and you can go to michigan.gov, and it's a free service to help people quit. It's really important. And I hope that you feel it's important, that you feel like you can share with maybe a loved one saying, hey, I would like some support to quit. It's important. It's important to me, and I hope that you are encouraged by this information to make some changes. We all have things we have to work on in life, and by God's grace, we can overcome them. So I would just want to make sure that you know that you are important, and I really want to thank you for this opportunity to share this information. And if you have any questions, or if there's anything that if you have a question, if I have an answer, or if I don't have the answer, hopefully I could find that answer for you. I hope that this was helpful to you, and I hope that you are blessed by this information, and I hope you have a wonderful evening. Thank you.